Welcome to this week's episode of UT Southwestern's What to Know. If you're following the COVID-19 news, you know the headlines. Increasing numbers of cases throughout North Texas and throughout the state of Texas. So are the numbers trending upward simply because we're testing more people? Are they on the rise because of the large social gatherings that we've seen in recent weeks? Are they a result of loosening of business restrictions or an increasing number of social interactions? Here to help us answer those questions, examine the facts, and most importantly, inform you on the best ways to protect the health of you and your family are Dr. Kelvin Baggett, the COVID-19 Health and Healthcare Access Czar for the City of Dallas, and Dr. Richard Medford, an infectious disease doctor who studies COVID-19 forecasting here at UT Southwestern. Welcome, Dr. Baggett and Dr. Medford. Dr. Baggett, again, thanks for joining us. Last month, you were named the City of Dallas Health and Healthcare Access Czar for COVID-19. Tell us a little bit about what that assignment is and what your goals are for the position.
Well, thank you very much for inviting me and giving me an opportunity to speak on COVID-19 and some other matters. Yes, I was appointed by the Mayor of Dallas, Mayor Eric Johnson, to serve as the City of Dallas COVID-19 Health and Healthcare Access Czar. And when he approached me about this, what he said is, obviously, we're dealing with a very serious and significant pandemic, and we want to make sure that we're doing everything that we can to protect the health and safety of the residents of Dallas. And we want to, in that, make sure that services are equitably distributed so that individuals know where they can go to get tested, so that they understand and have access to the appropriate treatment, so that we can reduce loss of life or any other deterioration in existing healthcare status.
The last several weeks, there have been a series of large gatherings to raise voices around racial inequality and to protest some of the injustices that we've seen across our nation. So how do you balance public health with raising a voice to call out and hopefully change these inequalities?
Well, I can say, fortunately, speaking specifically to Dallas, the protests for the most part have been peaceful. And I think that's the same for many other areas of our country. Obviously, there is a greater recognition now than I can recall at any point in my lifetime regarding racial injustice and the need for equality. And so what we have tried to do is to both support those protests that are done peacefully, recognizing that those voices need to be heard, while also recognizing that the uniqueness of this is that there's protests going on in the middle of a pandemic. So I worked a couple of weeks ago and wrote a document which is researched, evidence-based, that speaks to protesting during a pandemic and has areas that touch on policing and police considerations, that touch on protesters and things that they should consider both for, during, and after, as well as those that the protesters might expose themselves to following the protests as well. So we understand and expect that these protests are going to continue. Hopefully they will produce some of the meaningful changes that I think many agree are absolutely necessary, but we also want to make sure that there are considerations given for the health and safety of those individuals as well as those that they may come in contact with, given the uniqueness of both of these circumstances.
So as people are planning to attend one of these gatherings, tell us a little bit about what they should be thinking about and what they should be thinking about if they're bringing their kids.
First of all, you should assess your own health status. So if you have underlying conditions that make you more vulnerable, if you have hypertension, if you have asthma, COPD, if you have diabetes, those conditions that we've seen to create higher risk for COVID-19, then you should seriously consider not going, finding other ways to support the activities as well as to express your voice. If you don't have those conditions, then, and you're making a choice to go, then what we've also said is you want to wear a mask, you want to make sure that you are physically distant as much as possible, carry hand sanitizer, and then once you return home, you want to immediately remove your clothes, you want to shower, and you want to also be mindful of any contact you're coming in with others, as well as any symptoms that you may be manifesting. Those are certain, even on greater recommendations for those who are coming in contact with people who are elderly or have some of the other health conditions that I just mentioned.
Over the recent weeks, we've seen an increased number of cases throughout North Texas, including Dallas. What do you think those cases are from? And do you think do they involve the large gatherings that we've seen for the protest?
Well, it's difficult for us to say right now that there's a causal relationship between the protest and what we're seeing in terms of the numbers. But what we do know, based upon outside data globally and nationally, as well as the data that we're beginning to analyze internally, is that when you go into a large group setting, you are at greater risk for both contacting and contracting the virus, as well as spreading, potentially spreading and transmitting the virus. And so what we know is that we've had increased mobility due to increased reopening. We're seeing more large gatherings where people were physically isolated for months. Now they're coming into larger crowds. And so I think we can say with a high degree of certainty that these large groups, this increased activity is leading to an increase in the number of cases. That combined with the fact that we are testing more as well. We're working to scale up our testing, but we're also not just looking at the number of positive tests, we're also combining that with the hospitalizations and the use of intensive care units within hospitals. And we're seeing increases in all three of those. So we don't think it's just a reflection of the testing. We do think it's mobility. We do think it's increased group size that's contributing to it.
So just this week, UT Southwestern is now offering free testing for those who participated in the protest or any of these large gatherings. Do you think someone that's been at one of these gatherings should be tested?
I do. I highly recommend that if you've participated in a gathering, that you go and get tested so you will know your status. What we've said is that if you've participated in a protest within about 5 days, because we know that's the incubation period on average, that you should go and get a test so that you know your status. The thing that you can do to best protect yourself after you've been there and some of the steps we just mentioned is to know if you're a carrier of the virus.
And Dr. Medford, if you've been at one of these gatherings and you are thinking about being tested, when should you be tested in relation to when you attended one of the protests or gatherings?
First of all, thank you for having me and thank you for the opportunity. It's a good question. And as Dr. Baggett alluded to, it has to do with the incubation period of the virus. And what that essentially means is if I come in contact with someone with the virus today, that doesn't necessarily I'll manifest symptoms tomorrow or even today. What ends up happening is there's a time frame from when we do see symptoms frequently occurring. And that range can be anywhere from something like 3 days to up to 2 weeks. So I would say that it's probably not necessary to get it done right away, but within the first 3 to 5 days would be the most important period to get tested.
So I'll ask you both the same question, and I'll start with you, Dr. Baggett. Do you think some of these increasing cases you're seeing are a result of us letting our guard down? And should we be doing things differently over the next several weeks than what we've been doing perhaps the past couple of weeks?
I do. I think that there has been some misperception, and that has come in this sense that if it's open and we're encouraged to go out because of this reopening, then it also means that it's safer. This virus is not concerned with our reopening. And for us to be able to continue to advance, we need to take precautions. And the three things that have been proven to reduce your risk of infection are physical distancing, wearing a mask, and practicing good hand hygiene. So we're encouraging, continue to advocate for vigilance and adherence to all of those things and not to perceive this as, well, there's no longer the risk, because the risk is very real and the risk for some can be deadly.
So Dr. Medford, what do you think? Have we let our guard down? And as one of the forecasting experts here at UT Southwestern, tell us what you think we might see over the next weeks or months.
Yeah, that's a great question. And before I start, I just want to say that a lot of the work that I'll be talking about is really the result of a collaborative effort of multiple people across the campus. There are multiple departments that have been involved. But to answer the question clearly, yes, we definitely have let our guard down. The way our model works, it actually takes into account a lot of these physical distancing measures as well as the policies that were put in place. And what we do is we do this fancy math that really just stacks all of these policies one on top of the other. and we come up with a percent effectiveness of all these policy measures. Once we do that, then we can say in totality, we have this number, and currently Dallas's is around 61 or 63%. And what that translates to is something called an RT value. This RT value is critical because this really tells us whether or not the slope of the pandemic is going up or down. Anything above 1 indicates that there's an increase in cases, and anything below 1 means we're having the pandemic pittering down in a sense. So what we can see clearly is that when these social distancing measures and through the model, the effectiveness is higher, that RT value is actually decreasing. And what's happening currently is that effectiveness is actually going down, and we're seeing the result of that through an increase in RT and therefore increase in cases.
So as we think about the model, which has been incredibly helpful in our own thinking here at UT Southwestern about how we protect ourselves and our communities, now that we're seeing an increased volume of people, tell us what social distancing looks like as we're moving around and really thinking about how to position yourselves in larger crowds of people and with more interactions.
Yeah, it's a great question. I'll just echo what Dr. Baggett said. The responsibility is yours to protect yourself, so you have to assume that responsibility. As you're around crowds, obviously, your workplace, restaurants have put in these measures to physical distance, but it's really up to you to be able to say, I'm actually 6 feet apart from someone else. On top of that, I think the most important thing currently, recognizing that physical distancing isn't necessarily always possible, is the mask wearing that Dr. Baggett said. It's by far the second most effective thing, I think, after physical distancing. So really, I think everyone should be wearing a mask, and we really need to get to that critical value in order to protect everyone in our community.
Dr. Baggett, your messaging has been critical for the city of Dallas. Tell us a little bit about how you're talking about masks to the wide variety of stakeholder communities that you're involved with.
Well, thank you. At every opportunity, I will say, I'm continuing to mention it and to try to combat some of the misinformation that people may have around masks. I've been asked which mask is better and should I get different masks and those things. And what I've said is the mask that is best is the mask that you'll wear. If you're a person functioning within the community, you're not functioning in a healthcare capacity, and some of these are high-risk occupations, the most important thing you can do is to make sure that you are wearing it. Also trying to work with various businesses to make sure that masks are being promoted in their environment as well. And so you're seeing increased signage that's also being posted. You're seeing people being encouraged, because part of what we also have to get past is not only some potential misperception around the risk that still exists, but also, am I in some ways looking odd in a setting where I'm the one wearing the mask and others don't? We know that people are influenced by the behavior of others, so we're promoting that. So one, conversation promoting it. Two, with businesses, restaurants, service providers, and others, encouraging them to provide masks as well as to encourage those who are coming in to wear them. And then trying to help people get past some of the stigma and discomfort around wearing masks in environments where they may not feel that they're being used as frequently as we would want.
So Dr. Baggett, you spoke in the beginning about assessing your own health before deciding to attend a gathering or protest or even just be out in public. Tell us about special populations of people that should be even more concerned and perhaps not going to some of the opportunities that are now permitted as the city's opened up a bit.
Yeah, so I'll start with the elderly. So if you're over age 65, you should seriously consider if you need to go out. Others with conditions that we've identified that have higher risk of infection, those with asthma, so respiratory illnesses, asthmas, chronic obstructive pulmonary disease, those who have hypertension, other cardiovascular diseases, as well as individuals with diabetes. Any situation also that would compromise your immune system. So consider that, because obviously you need a healthy and robust immune system to be able to respond to this as well. So those are the considerations. What I will say, though, is that we're also seeing an uptick in the rates of infection and the rates of hospitalization amongst those who are younger. So as we discussed earlier, we attribute a little bit of that to the increased mobility and the increased rates of exposure that Dr. Medford was also speaking to.
So Dr. Medford, some have asked, is this all what we're seeing, this increased number of cases, is it part of the first wave or is it a second wave? And what should we expect around that?
Yeah, that's a great question. I'm going to get a little detailed about epidemiology for a second, but What we can clearly see right now is there's definitely an increase in cases, and we're definitely forecasting that, in 2 weeks or so, Dallas County is going to see approximately an increase in 20% hospitalization, and that's going to be around 450 to 500 total people hospitalized with COVID. We have what we call a wave, and then we have what we call a peak or a spike. A wave gets its name really from the way the epidemic curve looks, right? We have an increase in cases, and then essentially it peters down to no more cases. So to say that we're past the first wave means we would literally have to have 0 cases or near 0 cases right now. What we're actually seeing is this continual up and down spike and peak effect, which is a result of these loosening of restrictions and tightening. So it's this interplay between the two that's really, what we're seeing right now. What we can expect from a second wave is really a resurgence of cases, a number and the trajectory that will be much higher than it is currently. And that's kind of scary because with the way we look at it currently, our numbers are increasing. They're not necessarily decreasing. In general, when we think about these respiratory viruses, these second waves typically occur in the fall and winter seasons because that's when viruses tend to proliferate the most. That coupled with schools opening, et cetera, there's a lot that can happen in that second wave, and I wouldn't expect that to occur until later on in the year.
So Dr. Baggett, I'm sure you've been asked the question, so I'll ask it. What are you doing to protect you and your family?
Well, we're limiting our outside activity. We have 2 young children, and so they've spent a lot more time in the house. We've spent a lot more time in the house and taking some walks as best we could around the neighborhood at times when we think there's also going to be less activity. So first, being very selective when we venture out. The second is when we do go out, we're wearing masks and we're carrying hand sanitizer. 3, when we go out, we're being mindful and observant of those who are around us and getting comfortable with another part of this, which is asking for distance when we may feel that people are beginning to crowd the space. And so using our words and trying to use some other communication techniques to convey that. And then also making sure that when we return home that we are sanitizing, washing our hands thoroughly before coming in as well. So those are the things that we're doing to protect ourselves as a family.
How about you, Dr. Medford? What are you doing differently with you and your family?
Yeah, it's almost the exact same thing that Dr. Baggett's doing. We're very selective when we go out. We definitely make sure that we're wearing masks anytime we can. I think what Dr. Baggett highlighted very well was the fact that if you don't feel comfortable that someone is physically distancing from you, then it's okay to actually say, hey, can you move a little, or I might have to move a little in order to create that distance between us. And that's not always something that's very comfortable to do as an individual, but it's definitely very important in these times. And the last thing I think I've been doing, not necessarily to keep my family safe, but to keep my sanity is, we all crave social interactions. So if I can't do it with my family in person, I've definitely increased the amount of, I'll say, virtual contact that I've had with them, whether it be a telephone call or a video call.
So Dr. Baggett, thank you again for your leadership and the work that's gone on in the city of Dallas. Tell us a little bit about how we can help and what we should be doing as citizens of Dallas to make sure we flatten the curve as much as we can and help keep as many of us from contracting COVID-19 as we can.
Yes, thank you. So I'll reiterate some things we've already mentioned here, just in the last part of this conversation, which is be selective when you go out, make sure that you're wearing a mask, carry hand sanitizer, or make sure you have access to hand sanitizer. Those 3 help to communicate to others around the risk. And we have different interpretations and perceptions of what the risk really are. And so it's also helpful to be able to provide factual information and to inform people that there is still a risk and that there are certain personal behaviors that might be protective. We're in a period of coexistence with this virus, and we will continue to be in that period until we have a highly immunized population, vaccine, and some combination of those who have developed immunity and understand that a little bit better. But recognize that we have coexisted for decades, probably longer, with viruses to our knowledge, and that we've been able to do so through having very thoughtful practices and behaviors that protect us and protect others. So we can do this. We are able to do this. And so let's just continue to remain vigilant and have a collective response to this so we can protect the entire community.
Well, I want to thank you both for joining us today, and thank you for all you're doing to improve and protect the health of our community. Thanks again.
Thank you.
Thank you.
I hope this program was helpful in reinforcing all the things that all of us can be doing to keep ourselves and each other safe. Next week's episode will focus on mental health and how to improve and maintain your own mental health during the COVID-19 pandemic. I hope you'll join us. Until then, stay safe and stay healthy.